Welcome back to Primetime News.
And a special welcome once again to our viewers on onespotmedia.com.
Up first this evening, shocking details this evening about the conditions which existed at the Victoria Jubilee Hospital during last year's infection outbreak at the Special Care Nursery.
The details are contained in a Pan-American Health Organization PAHO report on the Victoria Jubilee Hospital, Bustamante Hospital for Children and Spanish Town Hospital. We have the details in this report.
The infection known as Klebsiella pneumoniae killed 12 babies and affected another 42 newborns at the Victoria Jubilee Hospital between January and December 2022. The Ministry of Health, in response to the crisis at the time, sought help from the Pan-American Health Organization, PAHO, and along with local experts, formed a working team to assess the situation. And what the team found was disturbing. For starters, the nursery unit was critically understaffed. Several infection prevention practices were also not being followed. So, for example, the equipment used to examine babies' throats were not properly cleaned or disinfected by medical staff. Some of the mattresses in the observation room are old and not properly covered, meaning patients were exposed to potentially harmful body fluids. The space between babies in the unit was not enough to limit spread. A tool used on the umbilical cord of babies was being kept for use for 10 days. Ideally, that should be 5 days. Medical gowns were worn by staff from one patient to the next and therefore increased the risk of the virus being spread. Open vials were not dated or labeled. The storage of cleaning items was not adequate. Also, used and dirty bandages were being left on the counter of the isolation room. Officials have also explained that there were no cases of the deadly infection at nurseries at other hospitals. To help keep it that way and prevent a repeat of the crisis at the Victoria Jubilee Hospital nursery, more staff is being sought. And especially in the case of the Victoria Jubilee, additional staff was hired or pulled from other areas to assist at the Special Care Nursery. In addition to improving staffing, the working team also recommended that the authorities offer advanced training in infection prevention control for the health workers. Additionally, the local authorities are being advised to follow the rigorous sterilization, sanitization, and cleaning practices for medical equipment as outlined by the World Health Organization.